Hello and welcome to the COMLEX Instant Review. Please visit comlexflashcards.com for complete COMLEX prep resources as you prepare for the COMLEX and USMLE board exam and as you go through medical school. Let's review several board review questions. Here you have a 22-year-old woman who is evaluated on routine physical examination. She does not smoke, drinks alcohol socially, and has 4 sexual partners and is currently in a monogamous relationship with a serious boyfriend. She has no history of STDs and takes oral contraceptives to prevent pregnancy. Recent HIV test is negative and she's due for a pap smear. And she has baseline PFT tests done which are okay. In addition to the pap smear, which of the following is recommended? Should you encourage screening for chlamydia trachomatis? Should you prescribe a multivitamin with folic acid? Should you encourage the use of sunscreen, or should you measure fasting plasma glucose levels? The answer here is quite obvious. The answer is to screen for chlamydia trachomatis. And again, the USPSTF recommends against routine screening for the use of sunscreen in order to prevent skin cancer. Also, it concludes that the evidence is insufficient to recommend for or against the use of supplements of vitamin A, C, and E, as well as folic acid. And there's no evidence also to suggest that fasting plasma glucose levels measurements in asymptomatic adults with type 2 diabetes is helpful. So, recommendations for screening for chlamydia trachomatis include non-pregnant young women aged 24 or younger who's sexually active, and for older non-pregnant women at increased risk. This is a grade A recommendation, and the grade B recommendation applies to pregnant women aged 24 or younger. Let's review another board review question. A 45-year-old black man is evaluated for concerns about his prostate cancer. Good friend was recently diagnosed with extensive disease and has a poor prognosis. The patient asks if he should have a screening test for this disease. He reports once nightly nocturia but has no hesitancy, urinary frequency, or dripping. Which of the following is the most appropriate course of action for this patient? Should you get the PSA, or should you look for a imaging study like ultrasonography? Or should you simply discuss the benefits and harms of PSA testing first? Well, the answer here is quite obvious. The patient really does not present with any evident signs of prostate cancer, and also screening is recommended, but before you can do that, you would actually discuss the benefits and harms of PSA testing. Let's review another board review question. 72-year-old man is evaluated during routine exam. He has a 45-pack-year history of smoking, but he quit smoking 10 years ago. He is fit and exercises aggressively. Again, he has no coronary artery disease, and physical exam is BMI is 26, pulse rate 62, and blood pressure is 118/64. He has a serum total cholesterol of 175, HDL of 52, low density lipoprotein cholesterol 102, and triglycerides of 105. What should you do next? Should you get a electron beam CT for calcium scoring, or a carotid artery ultrasonography, or should you evaluate for abdominal aortic aneurysm, or should you begin statin therapy? Well, this is a difficult question. The answer here is to actually go with the ultrasound to evaluate for abdominal aortic aneurysm, and it's recommended according to the USPSTF in order to make sure that the abdominal aortic aneurysm is checked for men in age 65 to 75 who have smoked. So this is a grade B recommendation. If you've ever smoked and they're in the right age range, you should have a one-time screening. That was an overview of several board review questions for the topic of prevention and epidemiology for the COMLEX and USMLE board exam. Please visit www.comlexflashcards.com for complete COMLEX prep resources, and subscribe to our blog as you prepare for board exams and go through medical school. Good luck in your preparation.